This is episode number 3 for our series on Ultimate NCLEX Review. These are pillars of NCLEX. I'm giving you short information, precise and concise, with test taking strategy and concept you need to know. First question. Which action demonstrated appropriate infectious control precaution? Selected apply. And this is caring for a client diagnosed with tuberculosis. This is how you answer your question. Go for your buzzword, tuberculosis. I said this to try to show you how you use language to confuse you, which action demonstrate appropriate infectious control precaution. It means, how can you control the infection of TB? That's all. How do you do that? For infectious control, you have to know the transmission mode of the disease. And then you use that to answer every question you're going to see. Wearing a surgical mask when entering the client's room is not appropriate because surgical masks will not be appropriate for tuberculosis because it's transmitted by what? Airborne. Assigning the client to a private room under Droplet. Private room is good. It's partially correct, but not Droplet precaution. Wearing a particulate respiratory mask, this is N95, when entering the client's room is to prevent what? Airborne, because the organism is in the air. Placing the client in the room with another client who has MRSA. MRSA is transmitted by what? Contact. You cannot put airborne and contact together, right? I will explain to you, even with airborne, you don't want to put two airborne together. But for the sake of this question, MRSA contact and then TB, which is airborne, cannot be together. The cohorting is based on the same organism. So two TB can be together, two MRSA can be together. But the caveat with two TB is you don't want to put two airborne together because it's difficult to create a negative pressure environment when you have two of them like that. Place N95 on the client for X-ray. When the client is going to X-ray, you put a surgical mask. So what is the right answer? There's only one right answer here. This surgical mask is wrong. This private is right, but not Droplet. Wearing N95 is good. You cannot put a patient with MRSA, and they should not wear this. There's only one answer, and that is number 3. Next question. A nurse is assigning rooms for a new admission. Which client can safely be placed together? That means who can be placed together, who can be cohort. They say placement of two patients together. Cohorting is based on the same organism. That means the same pathogen, the same name causing the problem, but different. Not the precaution that you're taking, right? Like if you take influenza and RSV, both of them can be transmitted by droplets, right? RSV has droplet and contact. But let's assume we're focusing on droplet. They can be transmitted by droplet precaution. But look at the name. Influenza and RSV, they are not the same, even though the droplet are the same. So these two cannot be together. That's the strategy concept there. Scabies, different name, and shingles, you can be together, right? Even though this can be contact and this is also can have contact, no. Strep pharyngitis and bacterial meningitis, right? They cannot be together. Yes, different organism altogether. And this is the same multi-drug resistant MRSA. So far as we can ensure that they don't cross-contaminate, it's possible to cohort if there's no room available. So these two MRSA organisms can be put together. Patients with MRSA can be put together. So 4 is the right answer. That is the concept. I want you to get it. Number 3, when caring for a client with Clostridium difficile, what is the best action by the nurse? That means what is the most appropriate way to take care of it? Then you go back to your infectious control. Identify this. This is Clostridium difficile. This is contact. Everything you do, it has to be contact. There's precise things associated with contact. Wearing gloves and using hand sanitizers after client care. After you take care of a patient with Clostridium difficile, he has spores. These spores cannot be destroyed with a regular hand sanitizer. So you need to wash your hands. So after care, hand sanitizer is wrong. Whereas surgical mask is a contact, going to prevent your contact precaution. So this is for droplet. And washing of soap and water after care sound right. Placing the client under airborne is not. Test taking strategy, you look at 1 and 3. Why are they talking about hygiene issue, both of them, but they saying opposite thing? That tell you one of them is the right answer. And that is number 3. Sometimes you have to look at the answers and then try to figure out using your concept associated with it. Which precaution is most appropriate? That means what should they do? And then it is providing care for a client with pediculosis, capitis. That means headlines. This is contact, right? Direct contact. Which precaution is most appropriate? Not droplet, not airborne, not standard. Is contact precaution. And that is the way number 2. That is straightforward. You have to know the organism and you have to know how it's transmitted. Which action should the nurse take? Same thing. A client with E. coli is incontinent of stool. That means even though E. coli is transmitted by oral um, intake, oral fecal intake, the patient is incontinent to stool. So you got to deal with their stool. That means you got to touch it. Therefore, this should give you an idea that this is by contact. Which action you should take? Wear protective gown and gloves when entering the room. Excellent. You wear it before you get to the room because it's contact precaution. Use a surgical mask. No, your face is not going near anything, so it's not going to affect you. Place the client in a negative pressure isolation. That is for airborne. Use an N95 respiratory mask. Like I said, you don't need a mask for contact precaution. Once again, you don't need a mask. So don't pick it. So the right answer is what? What do you think? Protective gown and gloves when entering the client's room. You don't need a surgical mask. You don't need negative pressure room. You don't need another mask here, different kind. Which client is most appropriate for a private room? Be careful. This is what I wanted to explain. Who is appropriate to private room? Look at it. Client with influenza, it's a droplet. You need it. Private room. Newly diagnosed chickenpox, you need airborne. Pneumonia, mostly, and coughing excessively, you need droplet. RSV is on oxygen, you need what? Droplet and contact. But this is the key. Who is most appropriate for a private room? These private room means that is all they can get. Influenza patient can cohort to another patient, so it's a semi-private room. RSV can also cohort. The only person who cannot cohort is chickenpox. And that is what I was explaining with the first question, that airborne precaution cannot be cohort. So they need pure private room. So for this, the way they can set it, that's the way I've shown you, that they'll give you all these things that need some form of private room, but the one that absolutely this is the most absolutely needed, is chickenpox because it's airborne and you cannot cohort. All the rest can be cohorted with another patient of the same kind, but they are classified as semi-private. Which client is most appropriate for a negative pressure room, private room? That means we have to achieve negative pressure room. In a private room, negative pressure is for airborne. Therefore, which organism is airborne? Client with active tuberculosis is airborne. Bacterial meningitis is droplet. Shingles usually is inactive varicella, and that is activated, right? They usually standard precaution, right? You cover it and you go. But if you spread disseminated herpes, this is like you go back to the original one. It's now varicella. It has spread everywhere. Even though it's shingles, we call it varicella. So you need a airborne and contact. Shingles that is localized to the frank area, there's no need to be placed in a negative pressure room. A varicella with a large crusted lesion, if the lesions are crusted, you don't need any more precaution. This is a test-taking strategy on infectious control mastering. I call it the fundamentals of infectious control. Thank you for watching. The right answer, as you know, is disseminated or and tuberculosis. So 1 and 3 are your right answer. They need a negative pressure room. Take care of yourself and have a good day and keep following the series. Good luck and keep charging as always. And if you like this video, share with your friends and bring them to adaptnclex for more content like that. Bye.